As if bringing a child into the world isn't scary enough on its own, there's all that helpful advice about what you should or shouldn't do, should or shouldn't eat or drink. And social media has only amplified the mixed messages. Joining us today to help separate fact from fiction is double board-certified physician in OBGYN and maternal fetal medicine, Dr. Kecia Gaither. She is also the director of perinatal services at New York City Health and Hospitals Lincoln in the Bronx. Welcome today. So you know what you're talking about.
I try to.
You know, oh, look, we're both old enough. We've heard all the old wives' tales about what you should or shouldn't do, or if you have this, you're going to have a girl, you're going to have a baby. And sometimes that really scares, especially a new mother, because they don't know what to think or do, and they don't want to do the wrong thing.
Absolutely, absolutely. Well, one thing that I usually like to tell my patients, first and foremost, is to stay away from alcohol when they become pregnant. That's the first thing. Alcohol is one of the leading causes of abnormalities in the baby, mental retardation, growth disturbances. That's all along a fetal alcohol syndrome spectrum. So alcohol is one thing that you can totally avoid that syndrome.
Yeah.
So if you want to have a little cocktail, have a mocktail instead. Get some fresh fruit juices and some ice, and you can work it that way instead of imbibing in alcohol.
One of the other fears that women have, because not every woman breastfeeding, we all know that it is the best thing for a new baby, but some people, for whatever reason, aren't able to do it very long. They don't give enough milk. Talk to me a little bit about when it comes to feeding the baby, breastfeeding versus formula. Is formula okay? How long do you need to breastfeed? All those things.
Well, breast is best, because what happens is when the mother breastfeeds, a lot of her immunological cells go through the breast milk, go to the baby, and it helps to boost the baby's immune system. With that being said, there are situations that moms have, be it they're on certain medications where they can't breastfeed, they've had a mastectomy where they can't breastfeed, they have certain medical conditions such as HIV where they can't breastfeed. So in those instances, the next best alternative is you can either bottle feed with formula, or we can talk about this in a minute, go to a breast bank. Now, if you're going to choose formula, that formula has been modulated to at least try and mimic breastfeeding to the best of its ability. Now, one of the things that has been in the news that is false is the use of an ingredient known as Carrageenan. Carrageenan is made from red seaweed. It is a naturally made product, and what its purpose is, particularly in formula, is to emulsify the ingredients, to ensure that all of the nutrients and the ingredients that are added to formula get to your little pumpkin, okay? So Carrageenan is good in that standpoint. There are other things that Carrageenan does do. It helps to decrease inflammation, boost immunity. It can decrease cholesterol. So from that standpoint, that's a great thing. Carrageenan also, like I said, is natural. It's totally natural, and it's in a lot of the foods that we already eat. Ice cream, yogurt, so forth and so on. So moving on from that, if we want to talk about a mom that really wants to breastfeed but can't, throughout the country, there are things called milk banks, where there are other mothers that donate their breast milk, in the hopes of helping some mother who really wants to breastfeed. The milk is screened, it is pasteurized, it is cleared of any type of infectious entities, and you have that option. And
it's okay if you mix the breast milk and formula.
It is.
And the baby's going to be perfectly healthy.
Absolutely, absolutely.
And so let's back up a little bit. We talked about the health of the baby. What about the health of the mom when it comes to what you should and shouldn't be eating when you're pregnant? Because there's a lot of talk about how much weight you should gain or shouldn't gain. So, women don't know, they don't want to do wrong, but they don't want to do too much of something or too little.
Correct. Well, there's a theory out there where you're eating for two so you can eat whatever you want. That's not necessarily true. what you want to do is you want to make sure that you're getting the most appropriate nutrients possible. So I usually counsel my patients, stay away from the fried foods, stay away from the processed foods, stay away from the sodas and sugary drinks. Instead, focus on fresh fruits and vegetables. You want to try and eat as many raw vegetables as you can, because when you cook, it decreases the nutrients. Okay. Plenty of fresh water. Now, there are situations where you have moms that are vegans or are following some alternative type of diet. In those instances, I would really strongly recommend that you go under the care of a nutritionist to ensure that you're getting the adequate vitamins and nutrients that you're going to need when you're pregnant and when you're subsequently breastfeeding.
Yeah, because you're trying to ensure that your baby is getting those adequate vitamins and nutrients. You know, one of the things that always surprises me is that some of it seems logical, and people are willing to believe that sometimes the most illogical things. Is it pregnancy brain, or is it just that fear of I don't know, of not making a mistake with that baby and being a bad mom at the...
Well, I think a lot of it falls under midwives' tales, old midwives' tales, and trying to listen to people who may have your best interest at heart, but are not necessarily telling you the correct information. So it's best to confer with your physician that's taking care of you. They're going to give you the best advice possible.
And has social media impacted how quickly that sort of bad information gets around and is repeated?
To a certain extent, yes. However, I would, encourage all of my listeners to make sure when you're looking at social media, make sure there is an MD behind the name that is giving you that particular information, and do your research.
Okay. Do you love this work?
I love what I do. I really do.
Okay. Such a pleasure to meet you, Dr. Gaither. I won't have use of your services, maybe in the next life. Okay. But I want to send folks to your website, KeciaGaither.com.
Exactly.
All right. Nice to meet you.
Nice to meet you, too. Thank you for having me.